Good evening, everyone. Just waiting for everyone to come in from the waiting room. Good evening, everyone. Just waiting for everyone else just to come in from the waiting room and we'll kick off shortly.
We'll just wait till 31 minutes past and then we'll go.
Sounds good.
Okay, so we'll kick off. Are you ready, Matt?
I'm all good, yeah. Good
Perfect.
evening,
So,
everyone.
good evening, everyone, and thank you so much for joining us. I'm Rachel Joy. I'm SheMed's Chief Clinical Officer, and I'm joined here tonight by Dr. Matthew Noble. He's our Chief Medical Officer. Together, we'll be taking you through what GLP medications are, how they work, and really what to expect. Maybe if you're thinking about starting them, you've recently started your journey, or simply you're just interested and want to learn a little bit more. Over the last few years, GLP-1s have increasingly become more popular, and we've heard a lot more about them in the news. And they are by far probably one of the biggest breakthroughs in health and medicine that we have seen in more recent years. We're today going to go through some simple facts about those medications, how they're developed, a bit of the science behind them, and how you can be safely supported to actually start these medications as well. At SheMed, really, we focus on the female experience because we know that with women's bodies, hormones, and health journeys, it's all unique to each individual. And our goal tonight is really to help you understand how GLP-1s fit into that. What do they do to our bodies? What results might you expect? And how to get the best out of treatment while making sure that you are supported and taking a really clinically led approach. We have collated lots of common questions that people have submitted prior to this session, and really we've tried to kind of put them into a structure that allows you to gain some insights into them, learning a little bit more about dosing, the long-term benefits as well. So we're going to begin with actually talking about what exactly are GLP-1 medication and why are they changing the way that we think. So in 2023, a new GLP-1 medication called Wegovy was licensed in the UK for the treatment of obesity and weight management. So although Wegovy was a newly licensed medication, its active ingredient, semaglutide, had already been available for several years under the name of Ozempic. This is a treatment for type 2 diabetes. Now, Ozempic was noted that it had a secondary effect of weight loss, which it led its manufacturer, Novo Nordisk, to conduct some additional clinical trials into semaglutide, really focusing on weight management. Actually, they used higher doses to really understand what the impact was and what it could be used for. As a result, Wegovy became the first licensed GLP-1 medication in the UK used for weight management. Now, in that same year, Eli Lilly also launched a new medication called Mounjaro, tirzepatide, which is a dual action medication, and that is also licensed for chronic weight management. Now, together, these medications have really transformed how we understand obesity and how we treat it. It's really given us an option to think about how we can clinically give an effective treatment to those and to help people regulate their hunger, stabilize blood sugars, and really support sustained weight loss. Now, I'm going to hand over to Dr. Matt Noble to really talk about those concepts of and how they actually work. So, Matt, to you.
Thank you. So I guess the big questions are, what are these GLP-1 medications and GIPs? So Both of these are hormones. Hormones are small molecules that the body produces naturally to help regulate what's going on within the body. Think of hormones as messengers, really, taking information from one part of the body to another, keeping everything in sync. We've all got millions of these hormones flying around our bodies the whole time that do everything from managing our appetite to managing how we think, how we act, how fast our heart beats, loads and loads of things that these hormones do. GLP-1, or glucagon-like peptide 1, to give it its full name, primarily works to slow gastric emptying. It slows down the emptying of food from our stomachs and suppresses another hormone called glucagon. It's naturally released by the body in small amounts after we eat. And that the idea of GLP-1 naturally produced by the body is to slow everything down, to help us digest the food, to make us feel full, and to stop us just continually eating and eating and eating. GIP, or gastric inhibitory peptide, another hormone, does similar effects. It stimulates the secretion of insulin, which is used to regulate blood sugars, and helps us to store and use fat appropriately. Like GLP-1, it too is naturally released by the body after a meal. So these drugs, GLP-1s and GIPs, are synthetic, created versions of these natural hormones. Crucially, though, and the breakthrough that the drug companies worked out was that whilst the natural versions that we produce after eating last only a few minutes in the body before they break down, these synthetic versions have been made to persist in the bloodstream for a week or more, so that we can prolong the natural effects and help us to feel fuller for much longer, as well as some of the other benefits which we'll talk about.
Amazing. So the next question is, how are GLP-1s treatments taken? So currently we have 2 licensed medications, as we've already spoken about, for weight management in the UK. These are taken as weekly injections on the same day each week. They are available in injection pens. These make it very convenient for an individual to administer the injection themselves, and especially for those where an injection may be a new thing that you are administering and you may not be that familiar. The injection pens are multi-dose. It means they have more than 1 dose in that injection pen. So both of the products available in the UK market have 4 doses in each injection pen, so therefore should last you for 1 month. When you do that injection, you need to choose an injection site. Commonly, this could be the abdomen, the thigh, the top of the arms, but it's really important that we are rotating those injection sites each week. In regards to the needle, it is a very fine needle that is used to administer these medications, and actually the needles are supplied with the medication, and at SheMed we supply them in your treatment boxes as well. Each week you do take off and you throw away that needle, and you are supplied with a new needle each week. There is research developing, new medications are being developed about, and how we deliver them is also being developed too. So over the next 6 to 12 months, we expect a new oral tablet version to be available on the market. Now, these are slightly different, and the efficacy of them is likely to be less than that of the injected versions. This is because of the difficulty of getting that medication to be absorbed by the stomach and the intestine after being taken in a pill form, as we swallow that medication and it's broken down by the stomach. So these medications have some small proteins in them that we call peptides. And the stomach, of course, is designed to break down and absorb proteins. So how we get the nutrition, it's how we get nutrition from our food now. So the drug manufacturers have had to work really hard and think of ways to trick the body into absorbing these medications without breaking them down first, which is why it's taken a lot longer to launch an oral version than our injectable versions that are available on the market at the moment. Now we're going to move on to who is eligible for GLP-1 medications. So currently GLP-1 medications have a really clear inclusion criteria. There are 2 main parts to this. So one is if you have a BMI of 30 or above. The second part is if you have a BMI of 27 or above with a weight-related health condition. This could be high blood pressure, high-risk cardiovascular disease, raised cholesterol, pre-diabetes, maybe polycystic ovarian syndrome. So these criteria exists in this class of medication, primarily known for its impact on weight management. Now, weight loss was originally seen as a side effect of GLP-1 treatment, as we spoke about earlier. So research now shows that many of the broader health benefits occur independently of weight loss, such as the improvement to our blood sugar levels and cardiovascular health. However, what's really important is maintaining a healthy body weight, and that is very important to ensure. So we do have to ensure that our inclusion criteria is met and that BMI markers are kept and that actually people are meeting that inclusion criteria before being started on the medication. So, Dr. Matt Noble, I'm going to hand over to you for the evidence and tell us a little bit more about it.
Yeah, I mean, this is a topic that you could talk on for hours all by itself. It's one of the hottest areas of research in medical science at the minute. Almost every trial that's coming out at the moment has some element of GLP-1 treatment in it. GLP-1s and GIPs work in a number of different ways. And as we know, they're very effective for weight loss, but we're also seeing lots of other benefits come to light in the research as time goes on. Most of these benefits seem to be related to the fact that the medications themselves, as well as being helpful for weight loss and making us feel full, have this generalized anti-inflammatory effect. And we know that inflammation in the body is one of the triggers for a lot of diseases. It's been shown to reduce the risk of heart problems, for instance. And in someone with pre-existing heart disease, treating them with a GLP-1 medication, we know from the research they can lower their risk of having a heart attack or dying, in fact, of 20%. I mean, these are massive risk reductions that we're seeing in some areas. Crucially, as Rachel just mentioned, in the last few weeks, we've started to see evidence coming out from the trials that these benefits around anti-inflammatory effects and reduction in heart problems and other things are independent of the amount of weight lost. Now, we used to think, okay, if you are very overweight, we know that probably your cholesterol will be very high, so therefore your risk of heart disease will be high. So it stands to reason, doesn't it? If we can encourage weight loss, we can get the cholesterol better, then the risk of heart disease will go down. And that's true. But GLP-1s in particular seem to have this really huge additive effect. So quite independent of the amount of weight loss, they seem to have benefits around anti-inflammatory effect. So that means that these GLP-1s and GIPs are starting to be recognized as a treatment in their own right, with a number of benefits to overall risk and longevity, and not just treatments for weight loss. This is a really hot area of research, and we're going to see lots of stuff coming out around this, I predict, in the next few months and years, because there are quite literally hundreds of studies into the effects of GLP-1s and GIPs going on at the moment. There are areas that are being looked at as diverse as Alzheimer's disease to liver failure, kidney disease, skin problems. The one thing to say is we still have an awful lot to learn about the multiple beneficial effects of these medications. And everything that we're starting to see at the moment is pointing towards this anti-inflammatory effect as being a real important effect.
Amazing. So we're just going to talk a little bit more around that and how SheMed actually looks at it is more than just weight loss. So as Dr. Noble just mentioned and we've spoken about is that these are very powerful tools and actually the health benefits are beyond weight change. So as part of SheMed and on our onboarding program, and throughout of our program, actually we require everybody to do blood testing. As part of this, people get to understand what their cholesterol level is, their risk of diabetes for a HbA1c level, their liver health, and their thyroid function. Really, this plays a really key role in understanding the wider benefits from GLP-1 medication and helping us to gain an insight into our own health and actually track that along that journey. We monitor these markers biannually, so every 6 months, we really encourage people to do a blood test and to understand the impact on their health so they can track those changes. So it could be, for example, lowering your diabetes risk from when you started to 6 months on the program. It may then move into maintaining that and understanding that your HbA1c level has reduced and you're able to maintain that while on the medication. It could be improving your cholesterol level and actually keeping that level at a manageable level as well as supporting things like liver and thyroid function as well.
So what to expect when starting GLP-1 medications? Well, Obviously, everyone's journey is going to be different, but there are some common patterns that we see when people start these medications. In the early weeks, the focus really is about your body adjusting, both to the medication and to those new signals which you will and won't be getting around hunger and fullness. Side effects are fairly common for people to feel in those early weeks whilst the body adapts, but for the majority of people, they do seem to be quite mild. These side effects commonly include nausea, bloating, some constipation, or some heartburn. For the vast majority, it's worth remembering these are temporary and these are about your body adjusting. And frequently, they do settle down quite quickly. Over-the-counter medications, making adjustments to lifestyle, such as eating smaller, well-balanced meals, keeping well hydrated, getting good sleep, exercising, can all help to overcome these side effects. In terms of effects, it's typical for people to notice a bit of appetite suppression that kicks in within those first couple of weeks, and then the weight loss starts to kick in around 6 to 8 weeks. And I can't stress this enough, it's really important that steady and gradual weight loss is the objective here, not rapid weight loss. And that's why titrating the dose gradually and carefully is definitely the best plan, both for those starting medications for the first time and also for those who might be switching from one medication to another. Balancing the effects and your body getting used to the medication, along with any side effects that you might develop, so that we can try and ease you into that journey and support you at every stage.
Great. So why are individualized titration schedules important? So Dr. Noble just touched on this already, but titration is a really important part of GLP-1 treatment and management, ensuring that it's clinically led and that you have the expertise that are guiding you on that journey. I can't stress the importance enough. So the process of slowly adjusting your dose to find the level that works best for you, balancing the benefits with minimal side effects, is what we call titration. For many people, some assume that titration means increasing to the maximum dose as quickly as possible, but actually that's not always the best approach. When adjusting doses, we consider each person's individual journey, aiming for a steady, sustainable rate of weight loss. Apologies. So that the body primarily loses fat and it doesn't lose muscle. That's really our ultimate aim here, is that we're losing the correct weight that we want to lose, we're minimizing side effects, and that you're feeling well. So titration also helps us to manage those side effects that occur as the body adapts to that medication. Really, ultimately, titration is about personalization, finding the right dose that works for you at the right stage of your journey. Now, titration can change throughout that journey. It may be that you may be on a dose perfectly working for you for a period of time, and actually we may need to change that, titrate it up or down, depending on what's going on and how your body is responding. So ensuring that you have the information, that you're clinically led, and you are getting advice on titration is really important.
So this is an interesting one, isn't it? This has been discussed a lot in the press over recent months, and it leans into what Rachel has just been discussing. What is Ozempic face? We know that these medications can result in significant weight loss. The key, as we've said, is losing weight in that steady and gradual way. And what we do know is if you lose weight too quickly, you start to lose muscle mass more than fat. And this excessive loss of muscle can often be seen most clearly in the face. It's the part of someone that's got a lot of muscle tissue around in the face, and it's the part of someone that we notice most often. And if you start to lose muscle mass from your face, you can start to lose some of your cheek and jaw definition, and that's what's called the Ozempic face. That's why we promote this slow and steady approach to weight loss. We sometimes get questions about why we aren't just whacking a GLP-1 dose right up to the maximum as quickly as possible. And these kind of side effects are part of that answer. Losing weight at a rate of 1 to 2 pounds a week is usually ideal for most people. And that helps the body to lose fat rather than muscle. And of course, exercising consistently, weight-bearing exercise, making sure your diet is high in protein and other good nutrients also helps to try and preserve the muscle mass and help us to lose what we want to lose, which is the fat tissue. Said we'd come back a bit later on to some of the other beneficial effects and what has been proven in trials so far beyond weight. So in trials so far, we have seen benefits for lower blood pressure, improvements in lipids, blood fats, and the associated cholesterol deposits called atherosclerosis associated with that. This 20% reduction in the risk of heart attacks and strokes in those with pre-existing cardiovascular disease we spoke about earlier. Improvements in how the heart works in those who've got mild or moderate heart failure. Improvements in glucose control in both those with and without diabetes. Improvements in liver health, primarily related to a condition called non-alcoholic fatty liver disease, fat deposit within the liver essentially. Improvements in knee osteoarthritis, both due to the weight loss and some of this anti-inflammatory effect. And the slowing of progression of kidney disease, particularly in those with diabetes, and also improvements in things like sleep apnea. We're also starting to see signs, although not proven yet, but signs from trials that GLP-1s and GIPs may also help with addiction, with substance use disorders, and even with things like dementia, Alzheimer's disease. And there's several really big trials in these areas that are expected to report soon.
Amazing, thank you. So what does the future hold? So the future for GLP-1 medications is rapidly evolving. We've spoken around the bigger impacts, the research, the studies that are coming out. We've talked about oral medication. And with the oral versions expected so soon, access and convenience are set to really improve. And at the same time, this body of research and real world evidence is highlighting that broader health benefits of GLP-1s that really do extend beyond weight loss. So with this expanding evidence base and really transforming how we view these medications, GLP-1s are really moving from being seen purely as type 2 diabetes medications to weight management tools, and now are actively becoming part of a preventative approach to long-term health. So supporting that management and reduction of chronic conditions such as diabetes and cardiovascular disease. So it's a really exciting time, and I think there's loads of research coming out, and we're really eager and excited to kind of see how that develops. Now, they are lots of the questions that we have received this evening. And I think for us, we have received lots of other questions, and we will be doing this as part of a series. There are a few areas that we will be exploring and launching over the next month. So we know everyone has lots of questions around switching from switching medications between Mounjaro and Wegovy and Wegovy and Mounjaro. We understand that lots of people are starting to reach their target weight and want to understand what's next, what's going to happen, what should I expect in my journey, or what should I do about next in my journey. Now, hot topic of microdosing, what is it? There's lots of questions. Why are people talking about it? And is there information and research around it? And also, lots of people will know that we did launch SheMed with a study, and our study papers will be out when they finalise over that year, and we would love to share those learnings with you that lots of people have contributed to. So thank you everybody for joining us. We know there are lots of questions. We will collate them all, and we will make sure they are presented back in a structured manner into our webinar sessions. So thank you, Dr. Noble, for joining us, and thank you everyone else for attending this evening.
Thank you, everybody, and I look forward to doing that again soon.
Thank you.